Our research was entitled Public Health, Urban Vulnerabilities and Neighbourhood Planning in Dublin, and we focused on the experience of a particular neighbourhood and community in Dublin 8 during the first lockdown. Our research really focused on communities living in the 4 social housing blocks located within this Dublin 8 area to understand their experience of lockdown, and in particular the highly restrictive 2 kilometres of the first lockdown. These communities have been traditionally disadvantaged in multiple ways, and we wanted to understand how their experiences differed, particularly from other communities that are better endowed in terms of housing, but also in terms of green space and green infrastructure. What we found was that the experience of lockdown was quite difficult in these areas. For example, when we're all told to stay at home and isolate, this is much more difficult for somebody living in relatively small housing conditions with limited access to quality outdoor space. The deficit of green spaces within this particular neighbourhood also had particular impacts in terms of what people could do within the 2 kilometres that they were constrained to during the first lockdown. What we found was that living conditions here were extremely poor, particularly when community and other service providers were removed from the area as a result of the first set of restrictions. However, despite the disinvestment or underinvestment in the built environment, what we saw was that the experience of lockdown demonstrated very strong community bonds and solidarity. Neighbours helped one another by shopping for one another, helping those who were isolating, but also trying to deliver the kinds of community services that public service providers traditionally provide here. What our research demonstrates is that public health has to be central to urban planning. We need to change our planning approach away from planning for profit and developable spaces into ensuring that quality of life is at the heart of what we do in planning our neighbourhoods.